Dr. Greenberg, you touched on a number of things that were on my list that we're going to talk about. And thank you so much for going into the research. So I don't think a lot of people are really aware of the researchers and then the biomarkers, the blood tests that you were speaking of. And let's talk about that. Let's talk about how patients are accessing making diagnoses earlier. Because what Doc Griggs also mentioned is that this is a disease that the family is experiencing, right? And what I often see on my end is just that family experience of having to care for a loved one who is losing function slowly, whose disease process has somewhat of a stepwise decrease as they may have an acute medical illness, that may set them back a little bit further. And these families are often looking for support. So if we could talk a bit about making that diagnosis earlier, and then also what supports are out there for family members and patients as they navigate Alzheimer's disease.
If I may, what's interesting is last week, in New Orleans, we had the Super Bowl, and I had the privilege of keynoting the conference on brain health. Particularly, it was African American men and brain health. Why African American men? Because we know that the risk for African Americans is up to 3 times higher compared to their white counterparts. We're talking about men. It's not just football that we're talking about. It's not just a CTE thing or a brain trauma thing. It's the fact that you're talking about two groups that traditionally there's a distrust, and they're less likely to go to the doctor because of their social determinants of health or their environment. We know that our health is determined 20% by our genetics and 80% about how we interact with the world. When you're dealing in populations that have limited access and limited participations in research because of the distrust in the system, if I distrust something and I'm not interested in it, I'm not going to keep up with the latest research. I'm not the breakthroughs won't mean as much to me, particularly if it has been passed down for generations that this is old timers disease, and that's just something that happens. And no matter what, I'm fine. Are you good? I'm fine. I'm good. I don't need to go to the doctor. I don't have a problem with the way that I interact with the world that it's you do. And there's this pushback. So again, it's more of an education thing, an acknowledgement, and really being able to step into the room, face people with the facts and the stats and the things that could happen to them, and then to Dr. Greenberg's point, pointing to the things if peripheral vascular disease in the community, they call it. I grew up with my grandparents and great grandparents call it poor circulation, and varicose veins, and people that worked on their feet a lot. So having varicose veins was something that you saw. So you just assumed, I just assume I'm going to have varicose veins. And when I reach a certain age, I'm going to get poor circulation, circulation. And as I tended towards the end of my life, my memory would decline, and there are things that could happen. And, you put Big Mama in the living room. They wouldn't go to the doctor. You put Big Mama in the living room, you get the hospital bed. There's no such thing as hospice care. There's definitely no such thing as memory care. There are certain resources that we don't know are available to intervene at even the later stages. So the discussions about what the problem is need to happen so you can find out how to intervene and possibly participate on the front end to ease the burden, not just on that patient that we hate to see our family members suffer through, but ease the burden on the family. And that burden affects all of the social determinants of health. And the saddest thing to see, and Dr. Greenberg, again, I always yield to your experience because you've been in it and this is what you do. But the saddest thing to see is the epiphanal moment that the patient realizes that they start feeling like they might be a burden to their family, which is what the last thing that you would want. So the more open dialogue, the more we're able to educate, the more we're able to explain things and take the time to explain things in ways that people can give it back to us and own it and take it to our families. It makes the discussion about resources. People, if I know that I need help, I know that I can ask for it because there are resources. Am I making sense?